Thank you for taking an interest in learning about the educational resources that go along with our Identify, Isolate, and Inform toolkit. If you have not done so, go to www.mypac.us to familiarize yourself with the other items in the toolkit. This tool is designed to be used in collaboration with the others presented in the series to create a comprehensive approach to the early identification, isolation, and notification of patients with or suspected of having a high-consequence infectious disease. This video is intended to support the implementation of the Identify, Isolate, and Inform algorithm in your facility. Additional instructional videos have been developed to enhance utilization and rollout of materials and tools that were developed to support the use of the algorithm. This presentation will show you how to effectively use MyPAC's Identify, Isolate, and Inform toolkit. This toolkit was designed to give your facility the building blocks to implement this approach to screening for high-consequence infectious diseases. A national work group of subject matter experts worked to create the Communicable Infectious Diseases Identify, Isolate, and Inform algorithm, which is the primary component of the toolkit. The toolkit also includes additional resources to support the implementation of the Identify, Isolate, and Inform algorithm. Separate instructional videos have also been developed for those resources. The toolkit is a starting point for implementing screening for high-consequence infectious diseases at points of entry for patients seeking care at your facility. As you work with the toolkit, you will notice that it is designed to be flexible to staffing and workflow patterns of the healthcare personnel that will be implementing it at your facility. However, successful integration of the screening requires interdisciplinary planning and support. A team of critical stakeholders should be assembled to develop and design your facility's specific workflows and rollout. Frequent review and maintenance of the tools and resources are required to keep them up to date and relevant at the point of care. If possible, consider integrating the tools in your facility's electronic health record system. We will now do an in-depth dive into the algorithm and how it can be used. This video is 12 slides long in approximately 10 minutes. The primary component of this toolkit is the algorithm, which was created by a national interdisciplinary work group of subject matter experts. Many items were taken into consideration when building the framework for this unique pathogen-agnostic algorithm. For that reason, please use the toolkit as it was created. Along with the customizable resources, this algorithm was designed to help you quickly identify a patient who meets the criteria to be a person under investigation, or POI, for a high-consequence infectious disease, isolate them safely, and inform the relevant internal and external stakeholders. The algorithm has been designed to include a plug-and-play feature. This allows facilities or public health authorities to request additional screening to identify specific or local outbreaks of a different communicable disease. This is a 9-step algorithm that is designed to be used by healthcare personnel at the point of care. It can be used in paper format or built into the electronic health record. Each step identifies the healthcare personnel role group or groups likely to be interacting with a patient at that point in the healthcare encounter. The steps of the algorithm have been developed to be appropriate for that role group and move the patient along the continuum of care. As the screening progresses, most patients will be moved into routine triage and care pathways, exiting the algorithm. As we review the algorithm step by step, you will see that using a tiered model allows your team to support and build upon each workflow from beginning to end. The algorithm starts with staff at the first point of an encounter. Frequently, this is clerical, registrars, or other non-clinical front desk staff. The questions to be asked at this point are appropriate by non-clinical personnel. But if the first point of contact is with a clinician, these questions should be asked by them as well. You will note that as staff ask the questions as written, there are action items to be taken based on the patient's response. These actions can involve 1. Taking steps to isolate the patient, such as providing the patient with a medical face mask to be put on at that point in the encounter that covers the mouth and nose, as in step 1, or placing them in an airborne infection isolation room, as in step 7, which will be shown on a later slide. 2. Moving the patient out of the algorithm and into other screening and triage processes per your facility's workflows. 3. Asking additional questions, and/or 4. Escalating to another member of the care team. As previously mentioned, each step on the algorithm also references tools and resources that are a part of the toolkit that can be used to support the staff in their implementation. The concept of the plugin feature has been designed to allow for adaptation of the algorithm to respond to additional transmissible infectious diseases that your facility or public health authority would like to screen for while leveraging the identify, isolate, and inform workflows that you have already established. The example provided is an outbreak of measles linked to visits to a local theme park, but it would also be monitoring food or waterborne illnesses by city or country. If a patient remains in the algorithm and has reached step 6, at this point a clinical team member, we suggest a registered nurse or higher, should be conducting the patient assessment and reviewing their answers. At this point, it is appropriate to ensure that the patient is still wearing their mask appropriately, covering both their nose and mouth. At this point in the algorithm, you will note the importance of the supplemental tools and resources. The details on these tools are addressed in targeted videos by our team, but key highlights are ensuring that the resources are easily accessible in an electronic format and up to date. Ensure that healthcare personnel know how to locate not only these resources, but also appropriate personal protective equipment supplies and preferred patient placement for isolation, if applicable. Now that we have gone over the algorithm, we would like to share a few tips and recommendations for how to implement this process at your facility. Planning. Identify and include key stakeholders and role groups in planning. Collaborate with the electronic health record team to assess feasibility of integrating screening questions and documentation in the EHR. Plan for which team/department will be responsible for reviewing implementation, but also maintenance of the supporting tools and resources. Rollout. Ensure targeted role groups have access to training on the algorithm, the support tools, and resources, and specific expectations for them in their role. Many facilities have found success in the implementation of similar programs by focusing staff on the why. For example, why is it important to implement this program? How does it help meet your facility's goals of patient care and staff safety? Allow staff opportunities to provide feedback on how to incorporate into existing workflows. Maintenance. Ensure tools and resources remain updated. Consider conducting mystery patient drills and monitoring utilization. Thank you for watching this educational resource. Please be sure to see the videos developed on each of the other tools in the series.